The good news is that the process of neuroplasticity is a constant throughout the lifespan. Neuroplasticity has to do with a lot of different changes in the brain. It can happen at a cellular level, as well as how the brain organizes neural networks, and they help us compensate for age-related changes. So there are changes in brain areas, including the frontal lobe, that can help us preserve our executive functions, our memory abilities, and solidify all of our cognitive functions. The concept of neuroplasticity also underlies this treatment that I'm going to talk about, which is cognitive remediation therapy. So, behavioral experience or the use of cognitive exercises and strategies can further support this natural process of neuroplasticity that occurs both in humans and in animals. So, exposure to targeted stimulation, such as what happens in cognitive remediation therapy, can further stimulate this process of neuroplasticity. We call that experience dependent neuroplasticity, which is the basis for why cognitive remediation is effective. So, now I'm going to talk about cognitive remediation therapy. The main principles we follow in CRT or cognitive remediation are all these bullet points you see on the slide: building awareness, barriers to using our capabilities. The treatment is goal oriented, so we work on developing goals that are reachable within a certain time frame of treatment. We collaborate not only on establishing these goals, but on modifying strategies so they work for you in your daily life. We make sure that the treatment is generalizable, which means that anything that might work in one of our sessions needs to be usable and applicable to the environments that you exist in, like at work or school. And finally, at the end of treatment, we really want you to be your own neuropsychologist. So you end up internalizing what we have learned in treatment. And so you can monitor when you are not using a strategy, when you might need to modify a strategy in real life, and therefore you have inner access to strategies that you've developed through the treatment. So cognitive remediation is tailored to the needs of the individual. It's not a one size fits all. It's a treatment where the provider has a toolbox of exercises and strategies to utilize depending on the needs of the individual. These are some examples of strategies that might be utilized in treatment. So it's a lot to digest, but as I said, it's tailored to the individual. So to help with attention and even short-term memory, there's various drills we use to practice enhancing focus. One of the things we do for attention is we actually build an attention voice. We ask ourselves, when we're aware that this information is important, we need to go through a script. Was I attending to that information? Was there an intention to remember that information? Was I distracted during the processing of that information? Can I repeat that information? And did I organize that information? And by building that internal script, it actually enhances our attentional capabilities and capacities in the moment we need to take in information. So that's an example of a strategy. What all of those approaches on that prior slide showed is that we use something called metacognition, or what we do in treatment is analyze our thinking about how we're approaching tasks. So in using metacognitive strategies, we work together to think about your approach to tasks. Once we collaboratively make that approach explicit and deliberate, we utilize that metacognitive strategy to help increase conscious and deliberate self-monitoring of how you go about tasks. So in that way, we're utilizing that top-down processing that sits in our frontal lobe to help us engage in goal-oriented behavior. So in developing an inner metacognitive voice, which we work on in treatment, you are become better able to effectively guide and monitor your goal-oriented behavior.